Following our previous neuro-ophthalmological videos, visual field defects, diplopia, gaze palsy, nystagmus, we present accommodation and pupillage. Now let's see what is accommodation in the eye. Accommodation is the process in which the eye see object at different distances and maintain clear image of the object by convergence and divergence. And it has two components, that is the near reflex and convergence. The near reflex is the pupil contraction when looking at the near objects and convergence of both the eyes. What is pupillary light reflex? It's a reflex that constricts the diameter of the pupil in response to light intensity. It's like adjusting a shutter speed in the camera in response to a bright light. So we test for it with the use of swinging torchlight test. If you show the light on one side, the pupil of the same side constrict. That's called direct response. And the other eye again also contracts. You can see the contract of the pupil is maintained. It's called consensual reflex. Neural control of accommodation. After the light passes through the optic tract, it anteriorly reaches the lateral geniculate body first through the retina, optic nerve, optic chiasm, optic tract, and lateral geniculate body. And posteriorly, from lateral geniculate body, it reaches the occipital cortex, and then it reaches the striate cortex. So that is the upfront route for accommodation. Then the efferent pathway descends to the parastriate cortex, and then it reaches the Fontaine center. There are subdivided into two different subpathways. There's one that goes to the third nerve nucleus, carries the motor fibers to the middle rectus, and the other goes through the Narenraj nucleus, and that passes through the ciliary ganglion, and it reaches the pupils. So the one that passes through the third nerve to middle recti is responsible for the convergence of both eyes, and the other route causes the pupillary contraction or near reflex. We'll see that pupillary light reflex control. The upfront pathway for the pupillary light reflex includes the anterior pathway of the visual tract, as I explained before, and then it reaches the pretextual nucleus. Then the efferent pathway comes through the Narenraj nucleus. This is an important relay station, and from there it goes to the ciliary ganglion with the sympathetic and parasympathetic fibers, and it reaches the pupils, so causing contraction. So now we will move on to see the defects involving the accommodation in pupils. So the causes include the presbyopia and the accommodation hasm or accommodative insufficiency. The relative afferent pupillary defect results in absence of pupillary light reflex on the same side. But when the light is shown onto the unaffected eye, there will be direct and consensual reflex, which is preserved. You can read the causes. Now we'll see the efferent pupillary defect. It is due to the lesion involving the efferent pathway. So one eye is not responding to the direct reflex or consensual reflex on the other side. So what is anisocoria? There is a difference in size of both the pupils of 0.4 millimeters or greater, but all the reflexes preserve the accommodation and light reflexes. What is Horner syndrome? It is characterized by certain features like meiosis, ptosis, hydrosis, and in ophthalmos. So you can appreciate here, there is a partial drooping of the upper eyelid. It's due to the sympathetic as well as a small pupil. Adystonic pupil. It has minimal or no reaction to light. Also, there is a slow reaction to the accommodation reflex. It's due to the damage of the parasympathetic fibers of the ciliary ganglion. The causes include ARP, adult Robertson pupil, diabetes, pituitary tumors, peniloma causing Perinard syndrome, myotonic dystrophy, pupillary light near dissociation. Here, the pupillary light reflex is absent, but near reflex is preserved. That the accommodation is preserved. Argyll-Robertson pupil is named after Robertson. The patient will have miotic pupils with irregular shape of pupils or contracted pupils, which usually caused by tertiary syphilis. Renix hemianopic pupil. So it's usually due to the lesion over the optic tract on one side. We can see the ptosis, anisocoria, and sometimes optic atrophy. So the causes, we know that stroke, trauma, brain tumors, multiple sclerosis, infection, and inflammation of the body. Accommodation reflex is preserved, but the light reflex is absent on the hemianopic side. Usually the hemiretina, where the light is shown, there's a difference in reflex. To summarize, understanding proper neurological control of accommodation reflex as well as pupillary light reflex is essential, as well as the eye mechanics. The bedside clinical examination of accommodation reflex and pupillary light reflex with a simple torchlight will help to localize the lesion. Then you do appropriate investigation to fix the final diagnosis. Thank you.